Hello, everyone. Welcome back to the Health Shack. Today, we have an important topic to discuss that affects millions of people worldwide: vitamin B12 deficiency. It's a condition that can have a wide range of symptoms and can go unnoticed for a long time. In this video, we'll dive into the signs and symptoms of vitamin B12 deficiency, why it happens, and most importantly, how to prevent it. According to statistics, up to 20% of people over the age of 60 in the United States and the United Kingdom suffer from vitamin B12 deficiencies. Unfortunately, B12 deficiencies are often ignored. So, if you want to take charge of your health and well-being, keep watching. Now, let's explore the common symptoms of vitamin B12 deficiency. Remember, these symptoms can vary in severity from person to person. 1. Pins and needles in the hands and feet. Our nervous system is significantly influenced by vitamin B12. It aids in the synthesis of myelin, which coats nerves and facilitates the transmission of feelings throughout the body. As a result, its absence may result in problems with nerve conduction or possibly nerve injury. As a result of peripheral nerve injury, people with vitamin B12 deficits, particularly elderly adults, may feel tingling in their hands and feet. 2. Fatigue. You will experience fatigue if your body does not have enough vitamin B12, but this kind of fatigue is not typical. You should check your vitamin B12 levels if, after getting at least 7 hours of sleep each night, you still feel exhausted. Your ability to focus and think clearly may also be impacted. The reason for this is that without vitamin B12, your body's cells cannot function normally, which causes a decline in the creation of regular red blood cells and poor oxygen delivery. You'll feel lethargic, fatigued, and disoriented if your body doesn't have enough red blood cells to transport oxygen to tissues. Studies have shown that taking vitamin B12 pills can greatly increase your energy levels if you have a vitamin B12 deficiency. Therefore, you may want to stock up on critical B vitamins again if you have trouble getting out of bed in the morning. Moreover, some studies have found that a specific lack of B12 or folate can lead to a condition called megaloblastic anemia, in which the bone marrow produces unusually large, abnormal, and immature red blood cells, impairing DNA synthesis. Megaloblastic anemia brought on by vitamin B12 deficiency can also cause memory loss, visual loss, and significant gait issues. So people, eat your vitamins. 3. Depression. Depression is a serious illness that is frequently disregarded. One of its many potential causes is a lack of vitamin B12 during pregnancy, youth, and adolescence. The development of our brains and cognitive abilities depends heavily on vitamin B12. Because of this, pregnant women should take multivitamin supplements containing a lot of folate and vitamin B12. According to some research, infants who experience vitamin B12 deficiency are more likely to experience depression as adults. Undoubtedly, depression is a complex issue with a wide range of potential causes, including psychological trauma. But you also shouldn't ignore nutrition. Eat well and enjoy the positive response to our film thus far. Please hit the like button and subscribe to our channel before we move on to the next symptom, so you won't miss any of our newest educational videos. 4. Yellowish skin. Jaundice, also known as icter, is a yellow or green pigmentation of the skin and the whites of the eyes brought on by excessive bilirubin levels. It can be brought on by a vitamin B12 deficiency. The waste product known as bilirubin is produced when your body destroys red blood cells. A lack of vitamin B12 results in fewer completely developed, healthy red blood cells. At that point, jaundice takes control. Your skin will often have a pale, yellowish tone. 5. Blurred vision. Your optic nerves may be negatively impacted by severe B12 shortages, resulting in hazy vision. You believe that you need glasses when, in fact, you require a sizable dose of vitamin B12 tablets. Therefore, before investing in a new set of glasses, you might wish to get your vision and B12 levels evaluated. And once more, people, take your vitamins. 6. No strength in the muscles. Well, going to the gym might not always assist if you feel your muscles are weak. Our muscles require oxygen to remain strong, just like much everything else in our bodies. The red blood cells in our bodies use vitamin B12 to synthesize red blood cells, which carry oxygen to the muscles. So your muscles may also feel weak if you are lacking in vitamin B12. So your concerns with muscle mass are not entirely resolved by the gym. Both boys and girls require vitamins. 7. Movement problems. Do you recall when we said that a vitamin B12 deficiency could harm peripheral nerves? However, such damage can make it difficult to move around or even run or walk. It can really. Deficits in vitamin B12 can become so severe that they may cause numbness, weakness, and the inability of your limbs to carry the weight of your body. Reflexes may also be impacted, so follow your mother's advice and take your vitamins. To remain on top of things, consume enough of beef, liver, chicken, fish, low-fat milk, yogurt, and cheese. You should also take a multivitamin pill. 8. Headaches. Yes, both figuratively and literally, vitamin B12 deficiency can cause headaches. Some neurological negative effects could manifest if your system is deficient in vitamin B12. Actually, headaches are the most typical sign of vitamin B12 insufficiency in both adults and children, according to the study. According to certain research, individuals who frequently report headaches are more likely to report low B12 levels. In a 2019 study, compared to participants without a history of migraines, only 50% of the women with migraines had low B12 levels. While additional research is required to determine whether medication with vitamin B12 helps lessen migraine headache symptoms, it is safe to state that the early results are highly encouraging. No more headaches then. Your vitamin B12 levels are high. 9. Irregular heartbeat. Tachycardia, or a rapid heartbeat, can be brought on by a B12 deficiency. Megaloblastic anemia, which in turn causes weariness, appetite loss, and heart palpitations, can result from low levels of vitamin B12. Your heart starts to beat erratically, which causes heart palpitations. A rapid heartbeat can cause uncomfortable pounding and fluttering, as well as panic attacks. Anemia, which can be brought on by B12 deficiency, is directly related to irregular heartbeat. Therefore, having insufficient levels of vitamin B12 might eventually result in damage to your heart muscles or even an enlarged heart. Therefore, up your B12 intake and practice tenderheartedness. 10. Memory loss. The body's capacity to absorb vitamin B12 declines with aging, as we stated at the outset. According to studies, long-term B12 deficiencies in the elderly may cause dementia, confusion, and memory loss. B12 may be beneficial for people who are already dealing with memory loss, but there is presently insufficient research to support this claim. So get your vitamin B12 today. Just to be sure you know, vitamin B is more common than other B vitamin deficiencies. Malabsorption, malnutrition, indigestion, or autoimmunity can cause it. Different conditions such as Crohn's disease, surgery involving the digestive system, or low stomach acid can also lead to low absorption of vitamin B12. So check your vitamin B12 levels, make sure you eat all the right foods, and lead a healthy, active life. You'll be fine. Remember, your health is in your hands, and recognizing the symptoms of vitamin B12 deficiency is the first step to a healthier you. If you found this video helpful, please give it a thumbs up and subscribe for more informative content. And as always, consult with a healthcare professional for personalized advice. Thanks for watching, and take care.